All right, let's look at this case notes and write a letter on this. So first of all, I'm removing all the unnecessary details from this case notes. So here, for example, in your answer, this part is also not required. So I'm going to start this letter in a very easy way. How to do that? First of all, we need an address and a date. So we have to write D, A, D, R is the first part of every letter. D stands for date. And what is date? Date is here. We are taking this date from here. I'm copying this date and pasting it here. Look at this. And here is a date. We got the date. But you have to change the pattern of the date here. It should be, the style should be like, yeah, 12th February. Yes, 2024. So we wrote the first element of the letter here. That is it. And now we need the address of the recipient, DADR. And where is the address? Address is to be found at the end of this one. Here we can see Dr. Vincent Raymond. This much is the address here. I'm picking it here and I'm placing it here. So we got the address now. Dr. Vincent Raymond, remove the commas and everything else. Terrace and right here, Brisbane, that's it. So we got the second part of the letter also. This is it. Now we need dear, since it is a doctor, dear doctor. That is fine. A comma is mandatory. Then we need the next line, that is RE line. In this RE line, we need two people, take two names here, two things here. One is the patient's name and this one. We got the patient's name here, and that is Dulcie Wood, and there is a semicolon and a date of birth, and here you can have a hyphen, and this one is fine. So since we wrote the date format in this way, try to change this date format also. So this will become 15th, what is that? July, June, I don't know, June, okay. So remove this one. I think July, right? July, then 1962 will be the full. So we got this whole thing here. So what are these? This is known as the D for date, A for address, and D for dear, and R for. So this is the first part. What is that? This part is known as the launching of the letter, and launching is done with DADR. Always remember, this is the starting point of every letter. We write with the launching. So the launching part of this letter is done. Now it is time for us to go to the next one, next area of this letter. We are going to the second part, that is opening part of the letter. Opening part is done with two codes. We can use two code here. One code is PRPDD or PRPTT. Now please tell me, is this letter a TT letter or a DD letter? DD means discharge letter. TT letter means transfer letter. T for transfer and D for discharge. Can somebody tell me, is it a PRPTD or PRPTT? Anybody knows? Aishwarya, what is this? Is it a discharge or transfer? Okay, if you don't know that very clearly, you have to always look at that part. That's very important. Is this patient being discharged or transferred? Write a letter addressed to Dr. Vincent Raymond, Wickham Terrace, Brisbane, describing the situation. But this is not showing the clarity. There is no clarity here. We need something else. Subjective, initial improvement is there. Very nervous and upset. Wants a referral. We got it. Wants a referral to cardiologist Dr. Vincent Raymond, who treated her sister for the same condition. Okay, look at that part. Who wants? The patient wants a referral to a cardiologist, and the cardiologist's name is also here. Now you are writing a letter. Now my question is this letter a discharge letter or a transfer letter? Are we transferring the patient? Are we discharging the patient?
Transferring the patient.
We are transferring the patient. Okay, is it an emergency transfer or a normal transfer?
A normal one.
Normal
It's a normal
also.
one. So with all your permission, I am going to remove the PRPDD because this is not a discharge letter. Reason number two is, how can you discharge a patient who is not admitted? The patient just came here presenting. So the patient was not admitted today. So how can you discharge the patient? Plus, so this is not an admission case. So easily we can decide that this is a PRPTT letter. Now, some of the new participants may be just wondering, what is this PRPTT? I'll show you that. P stands for patient's name. Patient. What is the patient's name here? Is it a Mr. or Miss, please? Is very clearly saying she has recently moved. So we got it very clearly. So here also RE, we didn't write that one, I forgot that. Miss Dulcie Wood will be there. This Miss was missing here, okay? So we got the patient, that is Miss Dulcie Wood is the patient's name. I'm taking it here, so we got the P. Now we need the second one, that is R. R, you know what is R? Simply write the word requires. Every time you can use the same thing. Patient requires. What is the next one? Then what is the purpose of this letter? Purpose. What is the purpose of this letter, please? What is the purpose? Wants a referral to cardiologist. All right, all right, all right. Okay. She wants purpose so when you refer a patient to a cardiologist, what will the doctor do? Yeah, assessment and management, right? Assessment and management. Now, I have a question to you. Do you think any assessment was done from this hospital? Did you do any kind of assessment? Because you are the nurse, you are the one who is writing this letter. Did you do any kind of assessment for this patient, especially the last one? You have prescribed Norton and you
Yeah.
have done some advice. Okay, and then here this is the last date. Reports less sensations. Just a BP was checked, and that was this. And the pulse rate also is showing here. Increase, okay, increase Norton advice review. This much is there. Then finally coming to the 12th of this month, initial improvement, but last day's heart seems to be fluttery several times a day and also at night. Very nervous and upset. So my question is, in the last one, did your doctor, did you do any kind of assessment? You just did the vital parameters were just seen by you. That's it. Did you do some CT or MRI, anything here, any test, any X-ray here? No.
No.
So you did not do any kind of assessment for that. Just a basic assessment was done. But you know that this patient is having heart-related problems. That means you have done some 10% of assessment has been done by you. In such a case, we can write, what is the purpose here? Further,
Further
yeah,
assessment
further
management.
assessment, correct. And management will be there. Now we got two more things to solve here. PRP, there's a full stop, and then we need to, we have already decided it is not a DD type of letter, it is a TT type of letter. What is the patient's transfer condition? What is the condition of the patient at the time of transfer? She has, yes, she has symptoms suggestive of. Can we say that one? That will be tricky for you. And then the last T, T stands for transfer. What is that? And is ready for transfer. And a full stop here. This is how you have to write. So how will you write? Miss Dulcie Wood requires further assessment and management, full stop. She has this one we have to complete. Anybody can complete now. And is here and is ready for transfer. This is the opening paragraph of a letter. Everybody, you may be following some other method, but this method is the most compatible one for anybody to write a letter. Because if you follow any other method, you won't be able to be so flexible as this one. Now, look at this one. Miss Dulcie Wood. What is this one? She has symptoms suggestive of, what is this? What are you going to write here? Somebody please tell me. She has What is the last condition that she is having? Heart-related complications, right? Everything is anyway, something is heart-related things. Everything is heart-related. And her sister was also treated for the same condition. Cardiac, can we say cardiac complications? Possible cardiac complications? Heart? Okay, fine. She is having heart fluttering. Okay. But that is just one of the symptoms that is very recent. Can you see the same fluttery condition in the earlier visits also? But we cannot be specific about that. Her condition, this is the last condition, but yeah, fluttery heart. You can write that way. But you can say some cardiac complication will be another one. So this is your own intelligence. You have to be smart and you have to write what is this. Cardiovascular respiratory examination was normal on that day, but later on, cardiovascular things were like him. So what are we going to write there? So here she has symptoms. She has
of cardiovascular
okay.
problem.
Cardio.
She has a for cardiovascular disease.
Okay, she has
Is
possible. She has possible symptoms of, or she has suggestive symptoms of,
cardiovascular
yeah,
disease.
symptoms of cardiovascular, or simply write, because we don't know whether it is vascular is also associated here. So cardio is sure, but we don't know whether it is because of the vascular pattern. So symptoms of cardiac, that is a better one. Cardiac, yeah, cardiac complications.
Disease.
Complications, yeah, complications, cardiac complications. Yeah. So here, rather than writing that fluttery, okay, that fluttery heart something, that is just a symptom there, okay, just a symptom. So we cannot generalize that the whole thing here. We cannot generalize that complications. She has suggestive symptoms of, or she has possible. She has possible cardiac, so possible cardiac complications and is ready for transfer. This is how we write using PRP-TT. Why did we select TT here? Because this letter is basically a transfer letter. We are transferring the patient to another facility. So this is a PRP. So always remember, whenever you write the second paragraph, sorry, the first paragraph of a letter, you should be following this method. What is that? Either you select PRP-TT, or if it is a discharge letter, you follow discharge DD pattern. I'm going to convert this same letter into a DD pattern. Look at this one. I'm going to change this. Miss Dulcie would require further assessment and management. DD stands for what? Discharge, right? So when you have to get the patient's assessment and management, you don't discharge the patient. Discharge happens when the patient is going home, right? So requires uh, like further care at home, care at home. Now we are converting the same opening paragraph into PRPDD style. Requires further care at home. Okay, then she is recuperating. Most of the time we have this one, recuperating after, suppose she underwent angioplasty, after angioplasty, and is being discharged today. This is the only difference between PRP-DD letters and PRP-TT letters. If you understand this, you'll be so lucky to understand any letter. Miss Dulcie would requires further care at home. If you want care and management at home, okay, she is recuperating after angioplasty and is being discharged today. Or you can also write and is being discharged tomorrow, no problem, and was discharged yesterday. You can write so many ways. Discharged 3 days ago, because after reaching home, the patient developed some complications. That is the reason why you are writing this letter to to the nurse who has to do this one. So there is PRP-TT and there is PRP-DD styles here. I hope it is clear to all of you. So if you have got it very clear, we can go to the next part of this letter. Further assessment and management. So we are selecting PRP-TT here. That is also clear to you. So launching part is done. And now we are doing we have just done this is opening part and launching part. Both of them are done now. Now this is time for us to go to the next part of this letter. What is that? Okay. This new patient has been presenting for the last few weeks. Okay. Now it is time for us to go to the next part. That is the narration part of this letter. What is narration part? Of course, you know what is narration part. Narration is the most beautiful part of a letter. This is the second paragraph, third paragraph, fourth paragraph, fifth paragraph, and the sixth paragraph of the letter. The whole letter comes, the remaining part, after the opening paragraph or the first paragraph, all these paragraphs will come. But for all these things, we have to select one of the two methods. What is that? The V method and the W method. V method and the W method. What is that? I hope you know this one. If there is anybody here who doesn't know what is the V and the W method, either you stay here or please watch the YouTube video. It is available on our YouTube channel. You can find it, the difference between V model and the W model. Now, my question to some of you is, which model is best for this? V or W? Are we writing to a non-patient, non-recipient or an unknown recipient? Unknown?
Unknown recipient.
Yeah, she checked and treated her sister, but that doesn't mean that the surgeon knows everything about this the patient. So most possibly this is a W type of letter. So deciding V or W is the most important one. Now, what is the other reason why? Is this patient's condition diagnosed? No. Again, W is the best one. And are we writing to a doctor? Yes. So for these three reasons, what are the three reasons? Number one, if it is undiagnosed. Number two, if it is a recipient is a doctor. Number three, if it is an unknown case. These are the situations when we write W model. And now, what is W model? What is W model? In this W model, you'll be having the first part will be completely past tense, right? Only the past tense here. This will be the present condition of the patient. That will be this one. Again, you have to go back to the past medical history of the patient. That is W, this one. Again, you have to come back to the present and go to future tense by coming to this one. So this is a W model. Everybody understand this one. So then I will tell you how to apply in this letter, when did the patient first come? Was it here? There was, okay, non-smoker, current medication, no non-allergy, subjective, and plan. Did you see here, review in 2 weeks if no increase in frequency? Did you see that? See? There are, how many dates are here, please? Date number 1 is here, 2nd January. Date number 2 is 22nd January. Date number 3 is 12th February. And then is there any other date? No other date is there. 12th. And what is the date today? Oh, it is also 12th, right? Fine. Yeah, you are writing this letter on. And today's date is, yeah, correct, exactly. So how many dates are here? Once again, look at this. There are 3 dates. My question is, where will you start the second paragraph? Will you start from here? Or will you start from here? Or will you start from today's date? Where will you start? Somebody please tell me. Where are you going to start this letter from?
Today's date. Today's date.
No, Rajat, there is a problem. We cannot write from today's date. We have to see when there are multiple dates. This is a question for many people. When there are multiple dates, where to start? See, I'm going to start this letter from the first date. The reason is What's the gap between the two dates? Can you see the date gap? Only 18 days, no? Yeah, around 80, yeah. And that is reason number one. Second one, you can see a review here. That is, this date is a continuation of the first date, right? That's a continuation because of the review. So the review is connecting the letter to the next date. Now, can you see the same thing? Advice review in 20 days. Again, that connection is there. Connection is there. They are connected. If this review weren't there, then we don't have to worry at all. For two reasons, you have to write this letter. The second paragraph should start from this date. The reason number one is this date is being followed by this date. This date is being connected to this date. That is the present date. That is reason number one why we are starting from 2nd January. The second reason is the gap between these dates is not far apart. They are close together, just 1 month, less than 1 month. And again, the conditions are also same, all related to, okay, although the first one doesn't have any cardiac problems were normal, so still that next day things improved, changed, complete changes happened. All right, so we are going to start this letter writing from here. So I'm going to show you how to write this one. Please have a look at this one. We have to first decide which things are to be included here. So we have completed the first paragraph. I'm taking you to the second paragraph. Okay, and these were the medicines that the patient was having at that time. Okay, you can include all these things here. Okay, look at this, and then we can say this one. All right. So all these things will be coming in this area. Take all the objective. If they are necessary, you can add them, and then height, weight, and everything is here. You can decide what is important and what is not important. You are writing to a doctor for further assessment, and the doctor should know everything about the patient. And this was planned at that time. You can also mention this. It was planned. Just stay here. I will show you how to write this letter. Okay. Okay, this was. So this first paragraph will be like, widowed January, 3 children wants regular checkup. This is a social part. This is social part here. Do we need the social part for a surgeon? She is a widow. She has 3 children. No, only this one was there. We don't have to write that one. So this is a second paragraph. So Miss Woods presented on, what was the date? On 2nd January. Since it is the first time we are mentioning 2023, 24, for regular checkup. Okay, when it was noticed that she had uncomfortable feeling in her chest several times in the last few weeks, like a heart flutter. This is the past medical history. We don't require this part now. We don't require this part. So keep it there for some other time. We can keep it. I'm going to take it here, and I'm going to keep it for a later purpose. Past medical history will only come here. And remember, if wherever you find things like this one, past medical history will come in the red area, the second red area. Look at that one, please, all of you. So the second red is only for the past medical history of the patient. So that will go in that area, okay? Then you have to write the remaining part of this letter this way. Last, okay. Non-smoker, and even this is also not required right now. This will also go up to here. We are just organizing this letter because you may remember I told you first you have to write everything. Medical part is to be written. All the medical things should be there. Non-smoker is not basically so this can be taken later on. And the medicines that you gave could be included here, no problem. But since you are writing to a doctor, that is not very important. You only have to mention that the medicines that the patient is taking right now. So this is the medicine that the patient started at that time, not very important one. Okay, so you can mention the medicines only if they are still being used by the patient. Otherwise, it has no relevance in this area. All right. So this will be in the past medical history area, non-smoker. So as I told you, first you complete all the medical part of this one. After completing the medical part, if there is anything emotional like depression and other psychological problems, you can write. Only after that you can write the lifestyle. For example, non-smoker and rarely drinks alcohol, that comes in the lifestyle of the patient, lifestyle. Okay. After lifestyle, you can include the occupational part. What is occupational? His profession, his job. Okay, that is the occupational part here. After completing the occupational part, you can write the nutrition part, including the BMI of the patient and the diet patterns of the patient and other things, weight and height. All these things will be coming in the nutrition area. After the nutrition area, only you can usually write the social part. Okay, social part comes here. And remember, this method is to be always followed for writing any letter. The order is always medical, emotional, lifestyle, occupational, nutritional, and social. In case, in some letters, you can write all of them together, but these two things will remain together, and these four things can be anywhere. But still, it is always better to write lifestyle first, then go to occupational things, nutritional things, and social things, or lifestyle, nutritional, occupation, and social. Sometimes lifestyle, social, this way it can come. They can be interchanged, no problem, not a big problem. Okay. So this is what I mean by the W method. So what you have to do is write everything from here. I'm talking about this part. To write this part, that is a second paragraph. Usually, this is a second paragraph of a letter. And this is usually the third paragraph of a letter. This is usually the fourth paragraph of a letter. This is usually the fifth paragraph of a letter. So if you follow this method, you will not commit any mistake. Maybe some of you will be thinking this way, this is really complicated, I don't want. No way, this is so easy and you can learn that very well. Okay, so after this, you have the next date here. Okay, so what is the gap between this one and that one? So almost after 20 days, you can write here. See, after about 20 days, Miss Wood, Miss Wood represented reporting represented 1 second, reporting less sensations but woke up twice at night during the last 2 weeks. Okay, once again, look at this. When you go to the third paragraph, you can follow this method. Okay, like this one. After about 20 days, Ms. Woods represented. Remember, the word represented should be having a hyphen between reporting less sensations but woke up twice at night during the last weeks. Then on examination, see, this will come like this one. On examination, come on, her BP. So now you can make a comparison between the previous BP. What was the previous BP here? It was 145 and here it is 135. So, okay, on examination, her, don't write BP, blood pressure was found. See, always use found mildly lower than the previous time. You don't have to mention what was the previous time. Okay, previous time. Okay, then see, there is a problem here. It is lower than the okay. Okay, and is it a pulse? And her pulse rate was regular. Don't have to write both the things. Okay. Okay. Now, based on assessments, comma, she was advised to, no, she cannot increase Norton to increase Norton to 50 gram daily. Okay, so definitely we cannot advise a patient to increase that one. You have to. So based on assessment, the dosage of Norton was increased to 50 gram daily. And okay, so you can write, okay, this way you can write, but if you want you can also expand this one daily, half tablet. This way we write half tablet in the morning, and half in the evening. Are you all listening to me or not? Okay, daily half. Okay, then she was. Then we need to write another word here, but you know that in OET we cannot write the word besides. I hope you know that. I hope you know that we are not supposed to write besides. So what other word can you write? Evening. Additionally, she was advised. To review in 20 days. So now the next date will come. Did you notice one thing? All of you? The whole thing is what tense? Which tense it is? Completely past tense here. And what tense is used here? The beginning part is completely, no, the whole thing is completely past tense here also. What is the thing here I'm talking about? We are writing the second paragraph of the letter. Sometimes if the second paragraph is so big one, no problem, you can cut it into 2 or 3, no problem. Okay, so we are still writing. So this date will be also this today, that is today, right? Today is came. Today, then we are moving to the present tense now, but you cannot suddenly enter into the present tense. Here, initially improvement, but okay, this will be also past tense here. This also will be past tense. Very nervous. However, okay, please note that she is, see, we are entering the present tense now. First time we are entering nervous and upset. Okay, she has expressed a keen interest in consulting you, because we are writing to the Dr. Vincent Raymond. We cannot call use the name here. Okay, you, since her own sister was treated by you for the same condition. Using you is not really standard way, but in this case we cannot use any other method. Okay, so here look at this. We have finally entered the present tense now. I request all of you, you should have a good common sense to decide where this red ends and where this one starts. Now we have to, after completing this one, it's time for us to go to you can also include this one. It's okay, completely fine. This one you can include, everything will be okay. You can include here. Now, finally, you have to go to the future of this one. Okay, just write this one, the past medical history. Please note that his, whatever the past medical history was, that her mother died of. So this will come much later here. Where will come it here? This will come in this area. Okay, and again, finally, considering the last paragraph, considering Miss Wood's current condition, kindly accept her, and kindly and provide a detailed investigation and for the treatment as this is beautiful as deemed appropriate. How many of you know this one? Appropriate. As deemed appropriate is a beautiful way of writing something. Okay, one second. This is to be in the present and future tense once again. So look at this one. The whole letter is written in past and present future method. Here we have it. This one is this one. This one. Okay, look at that. Okay, look here. This one. Okay, so this red part is this part. This is that red part. Okay, and then if there is anything present tense, you can write. But remember, in this case notes, we don't have much that one here, and this will be very small here also. This will be the pattern of this letter. Okay, maybe even this is also very less. We don't have much here. This is a pattern of this letter. Clear? Now, all the best. You can write this letter. You will not commit any mistake in writing a letter if you follow this method. So I think I have given the initial classes to some of you. If you're okay, you can start the person classes from me or from other trainers here. So please contact to continue your, person classes also. That is the end of this class. See you. Bye-bye. If you have any questions regarding this, yeah. If you have any questions, please ask me. Yes.
Yes, I've got a question, but it's not about the lesson. So I'll send you a text through my line.
All right. Okay. I'll check it.
Okay. Thank you, sir.
Okay. Bye. See you.